How do calcium levels indicate bone cancer in blood tests? Imagine your bones as the body's sturdy framework, constantly renewing and repairing themselves. When cancer spreads to these bones, it can cause changes that show up in blood tests, especially in calcium levels. Calcium is a mineral that makes up most of your bones and teeth, but a tiny amount circulates in your blood. This circulating calcium is essential for muscle movements, nerve signals, and blood clotting. Normally, blood calcium levels stay within a narrow range, tightly regulated by your body. When cancer spreads to the bones, known as bone metastasis, it can interfere with normal bone activity. Cancer cells in the bones can cause the bones to break down faster than they rebuild. This process releases calcium from the bones into the bloodstream, which can lead to higher blood calcium levels, a condition called hypercalcemia. Hypercalcemia is common in cancers that tend to spread to bones, including breast, lung, and prostate cancers. Doctors often order a blood test to measure total calcium levels as part of the diagnostic process. This test detects both bound calcium, attached to proteins, and free calcium, which is active in the body. Elevated calcium levels do not confirm bone cancer by themselves, but they can be a warning sign that warrants further investigation. If calcium levels are high, doctors may look at other markers, such as alkaline phosphatase, which indicates increased bone activity or turnover. It's important to remember that high calcium levels can occur for reasons other than cancer, like hyperparathyroidism or other medical conditions. Therefore, elevated calcium is just one piece of the puzzle. When combined with imaging tests like X-rays, bone scans, or MRIs, and a thorough clinical examination, it helps doctors determine whether cancer has spread to the bones. Monitoring calcium levels can also help manage symptoms in patients with known bone metastases. For example, if calcium levels become too high, it can cause symptoms like weakness, confusion, nausea, or dehydration. Managing these levels is part of supportive care, aiming to improve quality of life. In summary, calcium levels in blood tests can provide important clues about bone health in cancer patients. Elevated calcium may suggest that cancer has affected the bones, but it is not a definitive diagnosis on its own. It is always essential to interpret these results within the broader context of other tests and clinical findings. If you or someone you know is undergoing evaluation for possible bone cancer, consulting healthcare professionals is crucial for accurate diagnosis and personalized care. Remember, each case is unique, and medical decisions should always be based on comprehensive evaluation and expert advice.